Do you suffer from the debilitating symptoms of chronic pain, swelling, and loss of joint motion due to arthritis? Are you taking drugs like Celebrex and Vioxx or other super aspirin prescriptions? If you are, you're increasing the risk of heart attack and stroke by up to 50%. This is Dr. Tom Roselle, host of Dr. Tom Roselle Live Sundays at 12 noon. Why live with pain or the dangerous side effects of drugs when the doctors at the Roselle Center for Healing, practicing 21st century integrative medicine, can help you experience relief like never before? Simple, safe, chiropractic, acupuncture, and nutritional care can provide significant relief from arthritic pain in less than 6 weeks. More than 70% of our patients experience a return to life far beyond their expectations. Give yourself the best gift possible, freedom from arthritic pain, naturally. Call today to schedule an appointment. Call 703-698-7117 or visit online at rosellecare.com.
Dr. Tom Roselle Live, right now, on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. We are live, but we're not in studio, but we can give us a call today at 888-630-9625. That's 888-630-9625. Love to talk to you on any subject that you have in mind. Perhaps you've had a problem, you've tried, you've applied. Well, this is your opportunity to put the fire out, and we're going to talk to you about some very important information, some things that kind of affect many people on a subtle level or sometimes very blatantly and very out there. But many of you think that you have thyroid problems, and you've never really been diagnosed as such, which is suspicious. It is a problem. It's actually, in some levels, epidemic, and depends on what part of the country you're on. But in our area, in the metropolitan Washington area and the East Coast, we have a tendency to see these problems rise up and cause all kinds of things from, putting on weight and being bloated and mental problems and dry skin and hair falling out, and I can't think very well, and I'm totally fatigued, and I can't stay warm enough, and I'm covering up, or I feel even that you got to cry a lot, right? You watch a television commercial and you start tearing up. Well, that's thyroid. And we're going to talk about how that all happens. And with me today in Los Angeles, we are attending the International College of Applied Kinesiology, which is one of the most elite organizations in the world. Doctors are over the top. They're amazing, amazing people that have an intuitive insight from the triad of health, from structural, chemical, emotional. We have people here from Mexico. We have people from Russia. We have people from Europe. I mean, this is a gathering of eagles. It is an amazing forum. I presented on Thursday, and it was, I get out and I talk all the time, but when I get in front of this group of people, it's like, oh my God, I better have all my ducks in order and be able to present properly. Guess who's here with me? Somebody who's near and dear to all of your hearts, Dr. Leonard Poe. Hey, my friend.
Hello.
Having fun?
A little bit.
Yeah, well, it's like overwhelm, right?
Yeah, it's a lot. It's a lot to put in over a couple of days.
It is, and we've got to come, get back out and kind of hash it through.
Yeah, it takes a good week to sort all through it.
At least. And then not only that we got to study about it later.
And apply it, too, yeah.
This Wednesday evening, the 12th, I'm confused because we're in California, but the 12th,
get out of here.
I know, the 12th of the month, 7:30 p.m., you're going to be our in-house presenter. You're going to be talking about thyroid conditions, both hypothyroid and Hashimoto's thyroiditis and hyperthyroidism and all of those things that we need a divining rod to figure out. But at 7:30 p.m. at the Roselle Center for Healing in Fairfax, you are all invited. And as always, these programs are our gift to you. All you need to do is call our office at 703-698-7117, 703-698-7117. Tell my staff that you'd like to attend. We need the reservation, but we don't need anything else from you. We just your presence and a willingness to learn. Let's talk a little bit about thyroid problems and kind of the umbrella first of, what they're all about. How many people in this country would you estimate really suffer from, thyroid problems? Anywhere up to, some of the literature out there, goes even up to 35%. I don't know. That's why I'm asking you.
It's a large number. It's one of the growing epidemics. I mean, it's... You're talking about diagnosed or undiagnosed? I mean, what they really think the estimates are, because they're two entirely different things.
I know.
I mean, we're finding it more and more, and there's reasons why. And, unfortunately, they're all, the vast majority of them are environmentally induced, one way or another. Whether we're putting the halides in the breads or we're talking about, a lot of the radiation that we're being exposed to today, and it's, some of the things from the incident in Japan a few years ago. That's going to start speeding it up, but the numbers are increasing.
When we talk about xenobiotics, this is an area that is really part of that whole paradigm. And xenobiotics are, we say xenoestrogens, xeno meaning outside of our environment, free-floating, involved in everything else. But these, you talk about halides, and that's a big part of what we're seeing today. People know about iodine, and the thyroid needs iodine, tyrosine, trace minerals to produce something called thyroxine. But that's just the beginning of the story, as we tell our patients, right? Mm-hmm. And that's got to be converted. But what happens with these halides, and I'd like you to talk about it a little bit, is that they kind of compete for the normal thyroid hormone receptors.
I think this is one of those times where you and I actually had a clinical agreement of sorts.
Yeah, that doesn't happen too often.
That doesn't happen too often.
No, once in a while.
But this is something you and I have clinically debated for a while, and I think after this weekend and listening to some of the things, it kind of came together for us a little bit. Where some of that disagreement comes from.
We were both right.
Yeah, we were both right.
Uh-huh.
And, some were a little bit more right than others. But
yeah, be nice. Otherwise, we're going to spend this whole program debating.
But, the halides are a problem. And you get things like bromine and fluorine and things like that are much more reactive than the iodine. So you can have this need for iodine, but it doesn't mean that it's not in the body. It's because it's being blocked because you've got too many of these other toxic halides that are blocking the absorption of it.
Well, when we talk about halides, we're talking about, people have heard the term bromine. And
this is going to be tough today because we're in this little academic bubble.
Yeah, I know. It's tough.
It's going to be very difficult to...
We got to bring it down a little bit, right?
Yeah,
because that's where our brains have been thinking for 4 days. It's like, it's over the top and stretching and making the head hurt. But bromine is a halide, and fluorine's a halide, and so forth. And
iodine's a halide.
And iodine's a halide. But there are some that are destructive relative to their interaction with the human condition. But there's a lot of different sources of bromine. So people are saying, okay, where does all this stuff come from?
You're eating it.
Yeah, you're eating it. That's the whole point. They're spraying it on all your vegetables if they're not organic vegetables.
You're brushing your teeth with it.
That's right. The fluorides that, in your toothpaste. We have so many different inputs. If you buy a new car, the smell in the new car is a halide. It's a bromide that gets into your body, and as we said earlier, it competes for the receptors that iodine needs to fit into.
It competes much, much better.
It does. It's like, I'm first.
Yeah.
And then we have a problem. So we have this cascade, this body that's being beaten up, this inflammatory process, and somebody who that's more susceptible is going to be somebody who's in structural pain, makes it that much worse. Somebody who's overstressed, So how do you begin to distinguish, between somebody who has just, I don't feel good, or they've been exposed, they have a skin rash? How do you begin to weed through the process, relative to this is a thyroid problem?
For thyroid?
Yeah. That's what we're talking about. I know you've been in LA way too much.
I thought you said be nice.
No, so we got to go home pretty soon.
See, because now it's going to change.
You have 5.5 hours with me on the plane, so let's go ahead.
That's 4 going back.
Oh, okay.
But the easiest thing to do, of course, you've got all the symptomatology that's very, very unique to hyperthyroidism or thyroid problems. But then the easiest thing is do some blood work and look at it. By far, blood work's just a very, very simple way to see it. But the problem is...
But doc, they go to their doctors and they get their blood work done, and he says everything's cool.
Yeah. Because,
no problem.
Yeah, and that's the problem, is because the vast majority are running TSH and T4, and that's it. And TSH isn't even a thyroid hormone. It's a pituitary value. Okay, so you got to understand, when you go and you get just those values run, all they're looking at is there a place here for pharmaceutical intervention, and that's it. Okay?
But even
how do I dose it? How do I dose Synthroid or whatever we're going to use?
True, but here you have TSH. For example, the laboratory values say that there's like 0.57 to up to 4.5. Right. And some values go to, which is a joke. And they tell you that as long as you're within that bracket, you're cool. Everything's fine.
Yeah.
But functional medicine normals are 1.8 to 2.2, 2.3 at the max.
It's much tighter. It's like that for all blood values, but it's a much tighter value.
Well,
because that's function versus, statistics.
Well, big pharma's got to make money.
Yeah.
Somewhere. But we talked about T4.
They're making it.
They're making a lot of it. Unfortunately, at the cost of everybody else. 888-630-9625. That's 888-630-9625. Love to talk to you on this subject or anything else that you have in your mind. We've got a whole bunch of things that we're going to share with you. This Wednesday evening, June the 12th, 7:30 p.m., Dr. Poe will be your host, your presenter at our in-house continuing education program in Fairfax. Love to have you. Love to have you as our guest. All you need to do is give us a call at 703-698-7117. That's 703-698-7117. Tell my staff you'd like to register. We promise you, as always, a very informative evening, something that you're going to learn that you probably wouldn't learn anyplace else, but you got to be there to pick it up. So let's get back into talking about thyroid problems. You know, laboratory levels are off, and what people say, oh, your doc will say your T4, your thyroxine level, which is the primary hormone, is normal. But they still have thyroid symptoms.
Right.
It's not normal.
Because, and the thing you have to understand is that T4 is not what is used by the cells. Okay, that's not the bioavailable hormone for the cells.
But that's what Synthroid is.
Yeah, I know.
I mean, Synthroid is T4.
And that's why people still feel like crap when they're taking Synthroid most of the time. You still have to, that T4, okay, whether it's synthetic or it's from the thyroid, it still has to go to the liver. It still has to be converted properly, the liver and the gut. Okay, there's another 20% at least in the gut that has to be converted into T3, and that's the actual usable hormone for the cells to burn, to act as that foot on the gas pedal for metabolism.
Okay, so now we got T4 conversion to T3.
Right.
Okay.
Which is where most people it gets screwed up for them.
But they say that's not the end of the story. There's still other steps that has to go through.
Oh, yeah.
And there's an active hormone, and then there's, you need to know about that. So we need
pathway,
to total.
the pathway is, well, that's what the class is for.
Oh, okay.
The pathway is, it's an extended pathway. I mean, it's not as simple as this little feedback loop between the thyroid T4 and hypothalamus pituitary gland and TSH. It's not that simple. If you want to feel good, okay, if you want those blood values for TSH and T4, that's great. You probably still feel bad. You probably still have all the symptomatology. You can't lose weight. Your hair's falling out. All those pieces that go along with it. If you really want to feel good, you've got to look at that entire pathway and see, well, where's the glitch in here?
But also, not only that, and we talk about the entire pathway. We're talking about,
and then it's multiple systems that start to fall in with that entire pathway.
Yeah,
you got to look the adrenal system. You got to look at things like cortisol. Of course, the immune system's a big piece.
And the hypothalamus, hippocampus, all those little guys in the brain.
Pieces, the gut.
Yep.
Progesterone.
Yeah, it's not working the way it's supposed to.
All those things.
So, there's a dividing rod here someplace.
It's a complicated pathway because there's lots of pieces. This is one of those systems it's intertwined with lots and lots and lots of stuff. But if you go through systematically and you look at all these pieces, you can figure out, well, where is your problem?
I don't think there is a tissue in the body that is not dependent on thyroid function.
Every cell in the body has thyroid hormone receptors.
The thing that they don't talk about, we talk about T4, T3, conversion to T3, and then the available amount of T3, what's being taken in the system. But there's also this other 20% piece that nobody talks about. It's called T1, T2.
Yeah.
And that goes to muscle and ligaments and, soft tissue. So nobody talks about that except us. I mean, we deal with it.
That's part of the conversion.
I know. Yeah. It has to be done. It has to be done properly. But here's what happens. Even if you're converting or your doctor gives you an artificial form of T3, you still have receptor site incompatibility.
Right.
And that's what we were talking about earlier with the halides, and we talk about any type of inflammatory production whatsoever, what we call lovingly an inflammatory cascade. But once that's up, and again, emotional stress, trauma.
All those things will play a role.
Overexertion.
They're retinol dependent, they're vitamin A dependent receptors. Just like everybody kind of understands what insulin resistance is. That's a pretty simple model. Your insulin receptors are burned out. Insulin doesn't activate them. You can't get sugar put away, so you've got high blood sugar, and then we lead into diabetes. Thyroid is the same thing. Those receptors get burned out. They're not working right. You can't get the hormone in. So this is where it gets kind of tricky because all your blood values might look normal, but I still feel bad. And that's when you got to think about that receptor site sensitivity.
Well, we're going to get in that in depth. Dr. Leonard Poe, my guest, your host this Wednesday evening at the Roselle Center for Healing. We're in Los Angeles together at a gathering of eagles at the International College of Applied Kinesiology. Don't go away. We'll be right back after some very important messages. This is Dr. Tom Roselle. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a Do-It-Yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Did you know that routine mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? Now consider a simple, non-invasive, and totally safe medical procedure approved by the FDA since 1982 that can detect breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect the initial signs of breast cancer as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call the Thermography Center of Fairfax to schedule a breast exam today at 703-948-7248. That's 703-943-7248. For more information, visit www.thermographyscan.net. That's thermographyscan.net for the Thermography Center of Fairfax.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and a thermographic breast scan as part of your annual wellness checkup.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We are not in studio, but we are live. We're actually in Los Angeles at a gathering of the most amazing doctors throughout the world, attending the International College of Applied Kinesiology annual meeting. This has been an over-the-top. I mean, my brain hurts. It's like ridiculous. And we'll talk to you a little bit more about that. But this Wednesday evening, Dr. Leonard Poe, who is here with me, and, you know, we're both kind of in overwhelm, will be your presenter, your host, June the 12th, 7:30 p.m. at the Roselle Center for Healing in Fairfax. And he's going to be talking about thyroid problems, and that's what we're talking about today on the program. Want to let you know and remind you, Ageless Health 2013 is ready to rock and roll. We have a website. You know, all you need to do is go to agelesshealth2013.com and find out the different levels of attendance that you can do it now. You have a discount for the next 30 days, early bird registration. We've made this one so special and so involved. Ann Abernathy, who was known as Grandma Luge. She was a 5-time Olympian. Last time she participated was 1953, or when she was 53, not 1953, when she was 53 years old, is going to be our guest. And guess what? She is now going to be an archer and is ranked 9th in the world already, and looks like she's going to be doing another Olympiad at age 60. I mean, this woman is incredible. She's going to be one of our guest presenters. However, let's go to the phones, and Miriam from, I think it's Miriam from Fairfax. Did I get it right?
Maria.
Hello.
Hello?
Are you there? Hi.
Hi, this is Maria.
Oh, Maria, I am sorry. And
oh, that's okay, Dr. Roselle. I'm telling you, the timing of your subject couldn't be more perfect. I have a daughter who's 30 years old who about 13 years ago found out that she had a tumor on her pituitary and has been taking medication for the last 13 years.
Yeah,
she now, I would say probably within the last 10 months, has had a lot of headache issues, bloating, tired all the time, can't focus at work. Well, we're seeing a gastroenterologist who was convinced that she had gastro issues and has run every test possible, including a colonoscopy. In the meantime, she has seen an endocrinologist who put her on a low dosage of Thyroid. But the gastroenterologist told her to go off it because he was convinced it was a gastro problem. Well,
all right, let me give you. Go ahead, real quick, so I can answer your question.
She was only on the Thyroid for a month, went off it, and gaining weight like no other. So now she's back on it again. My question is there a problem with going on and off it that rapidly? And I mean, she's gaining so much weight.
There's more of a problem staying on heavy doses of medication for a long period of time, because what it does is shuts down the production of the organ. When you give too much thyroid hormone for an extended period of time, it's very, very difficult to get the thyroid to start working again. But what it tells you, obviously, is that there's a miscommunication someplace between the pituitary, thyroid, adrenal function, and intestinal system. They can all be involved. The whole idea is to find out which came first, the chicken or the egg. The fact that she's had this pituitary tumor for so long tells me that we've got a communication block there. and there may be receptor site incompatibility, which what I mean by that is that there's an inflammatory reaction that's blocking any kind of what we call upregulation throughout these systems. So you have to find out which one it is. Unfortunately, her metabolism is being ping-ponged. Yes. And you have to go down to lower levels. Synthroid is nothing but T4. If it's giving her some relief, then it's either because they're over bombarding the system with a lot of synthroid, which in the final analysis will actually cause its own problems, but it doesn't tell us what really is the initiator. Your history that you're giving me tells me that it's probably pituitary.
Yeah, if one of the things you have to consider is that I don't know enough about where the tumor is, but I mean, depending on where it is, it may be interfering with her ability to even make TSH, which is another possibility you have to consider. That's a very complicated situation.
So we'd have to
outside of normal function.
Have to find out what the problem is.
Well, I don't know what she's had done, but she has to have complete thyroid hormone evaluation from TSH to T4 to free T4 to T3 total, free T3, T3 uptake, reverse T3, thyroid antibodies, TPO, and then you need to look at the adrenal system and also the pituitary hormones. You look at all of that, and then you have to look at see where the gut's working. So there's a full workup evaluation that has to be done. I'd love to talk to you, more in depth on this and privately. If you can, you can call us or you can get a hold of me at drtomroselle.com. That's the easiest way to get a response from me. And you're welcome, obviously, to come to our presentation on Wednesday night. Talk to Dr. Poe. I'll be there for a while, and then I usually sneak out. But let's see if we can put more into this than what we have on the surface right now. But I'm more than happy to at least guide you, through the matrix. So I appreciate your phone call, Maria. Thank you for calling. Love to do a whole lot more for you, but I need to have a whole lot more information. We'll be coming up to a break pretty quickly and the news, and we're going to have a lot of information that I think that you're going to be really interested in finding out about when we come back. I'm sitting here in Los Angeles with the most elite and amazing doctors in the world. We're going to talk to you about that a little bit, too.
Yes,
Yes, I will. Yes, I will. Don't go away. This is Dr. Tom Roselle. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We are live, but we're not in studio today. We're actually in Los Angeles, talking to you in the morning for you at 12 o'clock in the Washington metropolitan area. My guest today, I won't go there. Anyway, Dr. Leonard Poe is with me. I was going to chive a little bit, but we won't do that. Anyway, we're here with the gathering of some of the most...
I'll leave.
No, don't do that.
I'll walk away. I'd rather watch what's going on in there anyway.
Yeah, I know. But you know what? You have an obligation to talk to these people that we have on
I'll
air
do it
right
for them,
now.
not for you.
I understand that. But Wednesday night, you are the in-house presenter. You are the host with the... I'm not going to say the mostest, but you're close. But you got to be there on Wednesday evening, 7:30. Dr. Poe's going to be talking about thyroid problems, which we're doing right now. And it's going to be a presentation that's going to be very insightful. Whether you have a Hashimoto's problem or you've been told you have thyroid problems of any kind, whether you think you have a thyroid problem, your doc said you really don't, everything's cool, but you know that you have all the signs of, your head doesn't work anymore, you're fatigued, you have dry skin, you have cracking skin, you've lost your eyebrows, you can't focus much anymore, and, it goes on. I mean, the list is enormous.
Do you have a thyroid problem?
I have had a thyroid problem genetically, and when I'm with you, my thyroid problem gets worse. It's this stress pattern that I go into. And yes, I do. Anyway, 888-630-9625. That's 888-630-9625. That's how you talk to us today on air. And if you'd like to talk to us anytime outside of the program, you can do that by either calling the office at 703-698-7117. And by the way, that's how you register for this Wednesday evening's program. All of our in-house presentations are a gift to you, and it requires nothing on your part except for a reservation. And please do that, 703-698-7117, and tell my staff that you'd like to be there. But if you'd like to talk to us also, you can go to drtomroselle.com, drtomroselle.com, and send me a note. And by the way, check it out. And by the way, Ageless Health 2013 is ready to rock and roll. It's a day that you will not forget. I want you to participate in this. I promise you. You're going to go away with more than you could possibly believe, to be able to take your health the very next day and explode it to the upside exponentially. Just go to agelesshealth2013.com and register today and save, because we have early bird registration savings for you. Give us a call today, 703 or 888-630-9625. 9625. That's 888-630-9625. Dr. Poe, let's get into...
Yeah, it's about time.
Thanks. Yeah, I mean,
I'm ready to walk away.
You're sitting there and glaring at me.
Yeah, I know.
You know, this is all about you. I was, just telling everybody to come and see you.
If it's about me, I'm going to go listen to Dr. David.
No, you have an obligation right here. David is great, but you're more important.
He's fantastic.
I know it.
He's the past chairman for the ICAK.
David is a brilliant man.
Yeah.
He's a guy that I, have admired for many, many years.
Who's the new chairman for the ICAK?
They told me that I got tapped.
Yeah.
Yeah. So
good for you.
I know. This is a huge organization. It's like I'm humbled. I do so much lecturing, but when I get on that platform in front of these guys, it's like, oh my God, my knees shake and my brain goes crazy. But it lasts about 10 seconds, and I'm good. We can go from there. Let's talk about thyroid problems. Yes, I have taken over the organization.
With thyroid problems, I mean
you are giving me a thyroid problem. Yes,
I'm trying to. When you look at it, the thing you have to really understand is that there are about 24 different thyroid patterns that can happen. Okay, it's not as simple as I just need to put more T4 in the system.
So Synthroid is not the answer.
There are multiple patterns that are involved there that will cause thyroid dysfunction, a true pathway thyroid dysfunction. And some of them start up in higher brain function with neurotransmitters, things like serotonin and dopamine, all the way down to the actual cell receptor and everything in between. So you've got to look at all those different pieces and really figure out, okay, what's the pattern why your cells are not getting the thyroid hormone they need, and then you fix that problem. Because if it's not a matter of, I just don't have enough T4, which is one of 24 patterns, then you're missing the whole ball game.
And also, people forget is that there is a relationship between metabolism and it just mean putting on fat, but we're talking about fatigue patterns and oxygen transport capacities.
The
and so
life
forth.
of your cell, how well that cell works and runs in all the tissues. So how well does your liver work? How well does your kidneys work? I mean, how well do your brain, everything.
In applied kinesiology, we respect the relationship between muscle function and organ systems, and every muscle in the body has that neurological coupling. And what we see with thyroid problems, I will talk about the muscle in a second, but we see shoulder dysfunction. Mm-hmm. Get shoulder pain for no reason whatsoever. And it's this fatigue where the arms feel like they're dropping and they just can't hold up into the shoulder. But you try to use the arm in any type of external rotation, reaching back, trying to get behind you, and so forth. You can't do it. It's either no power or it's stuck. And that muscle is the teres minor muscle, and it's one of the small, what they call rotator cuff muscles. And it allows that rotation to occur.
And then all of a sudden I have a rotary cuff there.
Yeah. And, it's just one piece goes to the next, goes to the next. So let's talk about that. Let's talk about the presentations of what takes place with thyroid. How does the patient know that they have an issue?
Well, most patients know. I mean, the physical symptomatology is what clues most patients into, and that, I'm tired all the time, I'm fatigued, my hair, I'm starting to lose hair, it's thinning, the lateral thirds of the eyebrows start to thin, the skin and the nails, all these kind of external organ systems. Okay, because the metabolism is so bad, they start to wean and they start to break down a little bit. So you don't those end. That's why we always talk about in traditional Chinese medicine things like looking at the nails, looking at the tongue, those end points, because those are the ones that get beat up the fastest.
It's an amazing situation. Every organ system in the world has an emotion. The thyroid is no exception to that. And, there's a lot of different pieces to that. I have a doctor who's part of the International College of Applied Kinesiology who is sitting here next to me, and probably more so than anybody else, he has some of the keys to that. And I just grabbed him off the hallway, and somebody who I've respected for many, many years, Dr. Tim Francis out of Las Vegas. Timmy, we're talking about thyroid function today, and we're talking about all those people out there, but you have a special intuitive look at how the thyroid will affect also emotional patterns. How does a patient know that emotional piece that they might be playing with might be related to a thyroid dysfunction?
Well, very often if their emotions seem to be up and down, what we call muddled instability, they might consider that they might have a thyroid issue.
There's a lot of muddled people out there, but what do you mean by that specifically?
Just sometimes almost like in a manic depressive type pattern where one minute they're extremely happy, and then the next they're extremely low, kind of like what we call lower than a snake's belly on the grass.
So that can be thyroid all by itself?
It can be thyroid. It can be blood sugar. Mm-hmm.
Wow. So when a patient comes to see you in your practice and they present with that type of thing, whether it's a manic, whether it's a bipolar situation, how would they really get, this is, I've been suffering this for a long period of time, and you would ask them the emotional pieces. What emotional pieces would you have to know that would begin to give you a little look at that this is a possibility?
It could be something that's aggravated in the fall or the spring when we go from hot to cool weather or cool to hot weather. It can be something that if they go for a period of time without eating, like the afternoon where they have a period of low blood sugar, if they seem to be aggravated around 3 p.m. or so. If they're feeling worse in the morning when they first wake up until they get their first cup of coffee or breakfast.
So it's a sluggish, I can't get it done type of situation.
That's absolutely, yeah. If they kind of pick up energy as the day goes on, kind of hard to get started, like starting your car off in sixth gear.
I do that on a time-to-time basis. That happens, almost too regularly. Dr. Tim Francis is one of the doctors that has been a member of the International College of Applied Kinesiology probably as long as I have. We've been together for many, many moons. An extraordinarily capable and brilliant clinician, one of my go-to people. He's on the other end of the country. Wish you were a little closer. But
Thank you very much.
I appreciate you letting me grab you for a couple minutes and talk about this.
It's been a pleasure.
Dr. Poe is going to be our guest and our host this Wednesday evening at the office, and he's going to be presenting a whole evening on thyroid dysfunction. I appreciate it. Thank you, Dr. Francis. We're here in Los Angeles at a gathering of Eagles, one of the most impressive organizations in the world relative to the things that we do. And, I'm waiting for people to walk by because these are like top shelf folks that teach all over the world and really make it understandable when it comes to the world of functional medicine. You can reach us here at 888-630-9625. That's 888-630-9625. Love to talk to you. This Wednesday evening, the 12th, 7:30 p.m., Dr. Leonard Poe will be in our office talking to you about this subject, thyroid problems, and all the pieces, from the emotional side of the triangle to the structural, what happens, the pain patterns, and also obviously biochemical, the presentations physically, why you can't get through some of the things, and also women, if they have a thyroid problem, and they may not even know they have a thyroid problem, can get pregnant.
And fertility is another a big component of that. Yeah, I mean, if your metabolism is not working, you're not going to be able to grow anything.
It's craziness. But there's a linkage to that, and the uterus and the ovaries, and it comes back to the same thing. The pituitary not only releases TSH, thyroid stimulating hormone, but it releases other things, FSH, LH, FSH meaning follicle stimulating hormone, luteinizing hormone, and both of these things cause, one, the release of the ovum, the egg, on a regular cyclic basis, and also the luteinizing hormone allows the preparation, of the bed, and also the fertilization and so forth. They're all hand in hand in one piece or the other. Obviously, I'm giving you snippets out of order that should be put back. And don't say a thing.
Does that happen for you every month?
Yes, it does. Why did I know you were going to say that? I knew that was going to.
Because it does something completely different for me.
Yeah,
just so you know, so that the guys can have some problems as well.
I'm going to tell my daughter on you. I just, that's all there is to it. She's got to bail me out on this one. If you'd like to register for Dr. Poe's, we promise you we'll keep the jokes to a minimum level on Wednesday evening, but nevertheless, we'd love to have you as our guest at the Roselle Center for Healing. Give my office a call at 703-698-7117. That's 703-698-7117. Tell my staff that you'd like to attend.
And this one always is a popular one because so many people have this problem. And, it is always so helpful to be able to understand the whole pathway, why I feel the way I feel, and really what the problem is.
So let me talk to you about one of the things that you and I know to exist. And unfortunately, in our society, so many people don't realize that this is a critical piece of thyroid hormone metabolism, and that's the liver. Mm-hmm. And we're constantly having to filter our environment with all the toxins that are around us.
And that's been one of the huge themes that we've seen throughout this entire conference is just how much stuff is out there that is just constantly bombarding us, just, soaking into our bodies. We're either putting it in ourselves or breathing it in. We're being exposed to it. And it's destroying our metabolism.
It's breaking it down. And the recovery process is long sometimes.
Our bodies were not meant to handle some of the stuff that's out there today.
No. And, we keep doing it to the point where there's so total, complete degradation of cellular responses and organ systems and neurological end plates and so forth. That's why we're dying. And, one of the presenters, I think it was yesterday, said, and I don't remember, it's a blur at this point. There's been so many top-notch presentations. He said, this is the first generation coming up, our children, our grandchildren, that will not live as long as we do and will not live as healthfully as we do, that their wellness quotient is very, very low. I mean, that's awful. It's a scary situation. It's because we are methodically, step by step, killing ourselves with our environment, and from thyroid problems to cancers to degenerative disease to our brains aren't working, Alzheimer's, dementia conditions,
obesity and diabetes.
It's awful.
I mean, it's terrible.
It is amazing. And, you sit there, and we deal with it every day. And for us to go to a conference like this and to see some of the most brilliant minds in the world coming up with the same things that we suspect, but with documentation that is clear and defined and applicable, we come back with better tools.
Right.
So we'd like to invite you this Wednesday evening as well. Join us, join Dr. Poe. We've got to come up for a break and listen to some very important information. Don't go away. This is Dr. Tom Roselle.
Educate, engage, empower. Take control of your health with Dr. Tom Roselle and the Roselle Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Roselle's Education Lecture Series video on demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomroselle.com/education. That's drtomroselle.com/education.
If you're looking for the best in natural health, wellness, and green living products, shop the Roselle web store on Amazon.com. You'll find a variety of products and resources that are designed to help achieve an ultimate state of health and wellness. Shop the Roselle web store on Amazon.com today. Visit drtomroselle.com and click on Roselle web store. That's drtomroselle.com and click on Roselle web store.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We are in Los Angeles attending the International College of Applied Kinesiology's annual meeting, a gathering of some most amazing doctors throughout the entire world, from every place from Europe and Russia and Italy and Mexico, United States, Australia. They're all here. Amazing group of doctors. All have some insights into natural functional medicine procedures that really are cutting edge, and there's very few like them. I'm proud to be part of this organization and have been for many years. Dr. Leonard Poe, as you know, is my guest, and we traveled together and picking up so much information. Our brains are on overload. We're going to be headed back later on this afternoon, our time here, and so you'll forgive me tomorrow morning when I walk in the office very early, blurry-eyed, or don't know who I am or where I'm at, but nevertheless. So, talking about thyroid function problems, and this Wednesday evening you're going to be our host, our presenter in office, and obviously our audience is welcome at any time. It's always a freebie to them. You're welcome to join us, but please call our office at 703-698-7117. This is a very popular presentation, and at times in the past we've had to do 2 nights because we have a full house. So call us, first come, first serve, but we do have to have reservations. Let's talk a little bit about Hashimoto's. You wanted to wrap that up a little bit with this topic.
Yeah, you always have to include that when we talk about this, because the high percentage of cases, the one piece that is wrong with the thyroid is it's an autoimmune problem. And it's not always, now, and let's be clear about this, it's not always a functional problem with the thyroid itself. Sometimes it's the fact that the immune system is attacking it, destroying it, and keeping it from making hormones. But you still have to go back and differentiate, is this an immune system problem where it's attacking the thyroid? Because you can still have that underlying functional problem along with it, and you still have to treat that as well.
So in other words, you can have both.
You can have both.
Okay, or it can be one or the other.
It can be one or the other. But if it is Hashimoto's, then the thing that patients really have to understand is that is an immune system problem. And so you have to treat the immune system. I mean, that's the primary piece there. You've got to stop that attack on the thyroid. And that can be done. That can be managed. And 80% of the immune system is intestinal tract. A lot, yeah. Yeah, it resides there. That's your first line of defense, and that's the one that quells a lot of different things. The intestinal tract is, I mean, yeah, and if just about everything comes back to that intestinal tract and what you're putting in it Okay, so one of these, let's be realistic. One of the things that you have to do when you have an immune system problem, or really most of these problems, is you're going to have to change your diet.
You know, a great doctor from San Francisco, a guy named Richard Bella, I was talking to him yesterday and actually treated me, which was a wonderful thing. Richard's a chiropractic neurologist and really top-shelf guy. And Richard was saying that any brain trauma, any head trauma, not brain trauma, but any head trouble whatsoever is going to immediately cause the intestinal tract to be dysfunctional. It's not going to work the way it's supposed to. So if you ever had a blow to your head, your gut's not working unless your cranium and your neurology has been reset. And, you know, we've known that intuitively, and it's really great to hear somebody else back that up.
All the immunologists, I mean, they all say leaky gut and problems with bowel flora. That's what leads to all your immune problems.
You know, this program is always way too short. We're going to be leaving shortly. We'll be back in. We try to bring you the most up-to-date information as we possibly can every Sunday at 12 noon, right here where you're listening today. And we'll be back next week at 12 o'clock, and we'll be live in studio. We'll see you then. This is Dr. Tom Roselle.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.